And as more Michigan residents line up to get vaccinated for COVID-19, many are asking what they should or should not do before getting their shots. It's a good question. Our chief health editor, Dr. Nandy, joining us now to answer that question. And Dr. Nandy, you've had both shots. You're fully vaccinated. Tell us what we should know before we get the shot.
Glenda, yeah, I was lucky enough that I got both doses of the vaccine. And most people know, right, that they may experience some side effects. I actually had some fatigue and fever after my second shot. Only lasted a couple hours, but everyone is different, right? So what I suggest, especially for folks at work, is schedule some downtime or have a backup plan in case you feel a little crummy. Now, other important things that people should do include telling vaccine staff about past allergic reactions or allergies before getting the shot. Also planning to wait 15 to 30 minutes after getting the shot in case you have that rare allergic reaction. You need to know that. And also schedule your second dose either 3 or 4 weeks, depending if you get the Pfizer or the Moderna vaccine, depending on, again, which ones you're getting. Also plan to exercise your arm and also use a cool, wet washcloth over the injection site to help with any pain or discomfort. And lastly, drink plenty of water, drink plenty of fluids, especially if you develop a fever.
So, Dr. Nandy, what if you're an allergy sufferer like myself and you take an allergy medication every day? Should you disclose that and pain medicine after the shot, like popping a Tylenol when you're done?
Absolutely. Disclose any medications that you take right before you get the actual vaccine. Now, I get asked all the time by patients, should I take something before in case I'm going to get a reaction? So my answer is no. It's going to be in my do not do list. Please don't take any ibuprofen, aspirin, antihistamines, or acetaminophen, which is Tylenol, before you get vaccinated. We don't know if these types of medications, Glenda, will affect how well the vaccine works, but there's some indication that it may. So if you take pain relievers, however, after your shot, that's okay if you need to, but I would wait and see if you need it first.
Okay, you've got a don't list going, Doc. So what else is on it? What shouldn't we do?
Glenda, please do not get other vaccines within 14 days of getting the COVID vaccine. Please do not skip the second dose. Very important, unless you get some, bad reaction, then talk to your doctor, of course. Also, try not to schedule your second dose earlier than the recommended 3 or 4 week interval, right? Make sure you do it on time. And also do not toss out your mask and say it's all, good and toss out all the pandemic precautions. Very important still to follow those.
So once you do get your vaccines, can you socialize with other people when you're fully vaccinated?
Super important point. Being fully vaccinated, Glenda, does not, and I repeat, does not guarantee that a person will not get infected, right? Nor does it guarantee that it'll stop a vaccinated person who is infected from spreading the virus, because they could be asymptomatic. You still need to wear a mask and social distance to protect others, right? We got to get everybody over this, get the herd immunity. So please get vaccinated, but also please social distance and protect yourself and others after you get vaccinated.
All right, Dr. Nandy, thank you as always.
My pleasure. Thank you.
Alan.